So the vertebral column is comprised of the following vertebrae: cervical, thoracic, lumbar, sacral, and coccygeal. And often we break down and just use the first letter of each of those words because we're lazy. And so for the cervical vertebrae, we find they're in the neck, hence what cervix means. And to find those cervical vertebrae, we look for the following: the base of the skull, the occipital bone, and the first rib. And the 7 cervical vertebrae are between those two landmarks, base of the skull and rib 1, where the first thoracic vertebra is located. So C1 is the first vertebra, then there's C2, then there's C3, and then all the way down to C7. And we just use the first letter to represent each vertebra. 7 cervical vertebrae. Now, the thoracic vertebrae, they're located in the thoracic region. We can find those quite easily because there are 12 pairs of ribs that come off, or a pair of ribs that come off of each of these vertebrae. So we find rib 1, we find rib 12, and there's the first and last thoracic vertebrae, and there's 12 of them. And they're numbered sequentially: T1, T2, T3, T4, T12, and of course the ones in between. Then the lumbar vertebrae are located in the lower back, and these are found by finding that first rib, and then it's the first vertebra below that, and then all the way down to the last articulating rib, because then the sacrum is fused below that. So to find these 5 lumbar vertebrae, you just go with the vertebra below the first rib, and there's L1, L2, L3, L4, and then there's the L5 vertebra. The sacrum is composed of 5 fused vertebrae, but even though they're fused, we still see a segmental organization for the S1, S2, S3, S4, and S5 sacral levels. And this is significant because they still have nerves, the spinal nerves that exit below their associated intervertebral foramen, the dorsal sacral foramen in these cases that we're seeing, but neural foramen nonetheless. And then finally, the 3 to 4 fused vertebrae that make up your tailbone, the coccygeal vertebrae. So there we have our vertebral column and each of the regions. The vertebral column consists of some curvatures, so that we call them primary curvatures and secondary curvatures. First is our primary curvature. So there we have a picture of a fetus, and notice that the fetus is in the fetal position, hence the name. And the vertebrae makes this primary curve, this C-shaped curve, and it's primary because it's the first curve that we have in the vertebral column. And so that curve is retained in the thoracic region of our vertebral column. And so we call that curve in the thoracic vertebrae the primary curvature. But in adult, primary curvature. But in an adult, what we see is that in the cervical and lumbar regions, we have these secondary curves because they come after that primary curve in the cervical and lumbar region, where you hold up your head, and when you learn to hold your head up and learn to walk and stand, when these secondary curves have evolved. And these are also called lordotic curves because or they're just called lordotic curvatures. And in the lumbar region, if you have an over curvature in this area, they often call